Traction is something that can be done to treat a cervical herniated disc. I like traction because I understand the mechanics of applying traction to the neck and creating a distraction force on the disc and maybe creating some movement where the disc moves away from the nerve. I had a chance to talk to Hema, a licensed physical therapist, about how she uses traction in her practice. So for the patient with cervical herniated disc, traction is something, it's one of the treatment options for them. What exactly is traction?
Traction is distraction of the cervical spine. Pulling, yes. Right. Either it can be done manually by the therapist, or it can be done using a machine or a mechanical unit.
And that, let me just interrupt you. That really just means pulling on the head, pulling it up, and creating tension on the neck. And how does that help a cervical herniated disc?
So when a distraction force is applied, the basic concept that they say, I don't know if it's really proven or not, but I do see results with the traction, is when you stretch two vertebrae, it causes less suction pressure inside. So the suction causes the disc to go back in and not press on the nerves.
So this is something that's incorporated into many treatments, physical therapy, all sorts of, so something that patients can look for. Would they go to someone who just does traction, or is it something that they would do it more with chiropractic or physical therapy, or
I would say it's a part of physical therapy. I wouldn't say this patient only benefits from traction. Mm-hmm. It's a combination. That's what studies have proven, and not just traction by itself. Mm-hmm. Very rarely, some cases that yes, just doing traction, it does help them. But most often, we have to address the soft tissue structures that's causing this muscle spasms or tightness. You release that and do modalities and exercises that is in more cervical stabilization exercise, or even incorporate McKenzie exercises into them and add on towards traction. I have had a handful of patients who, not just with McKenzie exercises, but adding a traction made a good difference.
I see. So in your clinical practice, you've seen traction help.
Yes.
Do you see an immediate result? Like if the patient comes in with arm pain, numbness, tingling, you do the traction. Is it that within 3 seconds they feel better, or how does that work exactly?
I would say 50% of the patients, yes, they do get some immediate relief, and sometimes it's usually later during the day, or sometimes even the next day.
And how often should a patient do traction? Is it every day, or 3 times a day, or what?
Every day. Every day, you could do once a day, depending on their where they are they acute, subacute, or chronic. Right. The amount of time that they spend and how prolonged is the traction changes. So is it a static traction, or is it intermittent, which means that they pull and release, pull, release? It changes depending on their, which stage they are.
So a lot of patients can obtain the home cervical traction, which is a device.
Yes.
So that gives a constant traction. Yes. In the physical therapy setting, do you do a constant traction, or do you do a pull and release?
We could change again depending on what the patient's need are. We can actually put a setting, a constant static traction, and they stretch it for about 8 minutes.
So how do you know which one to do? Is it just based on how the patient responds at that time?
Acute patients, I don't put a constant traction. I do give some, time for them to relax, the tissues to relax. But in more than about 5 to 6 weeks, then we could go towards more longer pull. Okay. It doesn't necessarily mean the longer the pull, the better it is. It really depends on the patient. Some patients, they cannot just tolerate a long traction.
And when you say long, you're talking about 1 minute or 30 minutes? What is?
I would say 30 to 40 seconds of a pull and 10, 15 seconds of a release.
That's for the pulsing on and off?
Yes.
And for home cervical traction, they can keep it on for 20 minutes? Or?
And the home cervical unit is mostly a static traction. They cannot let go their arms. Right. They have to pump it, and they have to distract it. I would say leave it on depending on the acute pain that you have or the relief that you get, about 2 to 3 minutes on, and then you release it and relax it for a minute or two, and then again 2 to 3 minutes. So in total could be about 10 minutes.
Okay.
And under the direction of therapist, if the therapist wants you to do just static traction, the max you will go about 8 minutes.
And is there a pound weight?
Yes.
How do you know what to do, how much weight to do? Because you set you in the machine?
Yes. We go from anywhere from about 12 to 15 pounds to about even 30 pounds. It depends, I think,
On
the
the
size
person.
of the patient
Right.
and how much pull they can really tolerate. Whenever I put, for the first time I do, I range between 12 to 18 pounds and ask them, do you really feel a pull? Does it feel good? If they feel it's more painful, it's a lot of pull, I can't stand it. You gotta, go down. And you try it for a couple of sessions. If they don't have any changes, if they don't get any relief, then I wouldn't continue doing it.
So this is a typical traction setup in a physical therapist's office, right? And tell us what we're looking at now.
So this is the unit where the patient lays down on her back, and the head goes here, and the neck is here.
Okay.
This part supports just below this boxable area.
Okay.
And
It's hooked up, obviously, with looks like a cable here, like a
Yes.
piece of rope.
yes,
And that's hooked up to a machine,
yeah, the wires are connected.
which is now going to pull, so we can follow this rope down to here.
And these are
And
the
that
buffers.
puts a mechanical pull on the neck, and it's controlled by this box.
Yeah. So if you see here, this says the whole time. So how long am I going to keep the neck in a distracted position? Is it 30 seconds, 40 seconds,
see.
60 seconds? And this is where the rest time. So how long I'm going to give rest for that particular patient? Is it 10 seconds of a rest in between,
Okay.
30 seconds of pull?
I see. So you can control all the different, and you do that based on the symptoms that the patient has, right? So, okay. So let's see what it looks like to hook it up then.
So even, if you want to just add on a
Yeah.
couple of things here. See, there is here, you see progressive intermittent. So once I set there, it's going to do 30 seconds of pull and 10 seconds of release. But if I set as static, it's just going to keep it, this doesn't, the minutes doesn't count anymore. So as long as I keep it at 10, 15 pounds, whatever I decide, I keep it on a static traction. It just keeps it pulled for that amount of time that I set here. For just for demonstration purpose for 10 minutes, and I'm going to switch on. Start when I increase a pound, right now it's about 15 pounds there. You can see a small pull up behind it. When I increase a little bit more, it's about 20 pounds. So it's just distracting her neck comfortably enough.
How are you feeling now? Does it feel like a lot of pressure?
No,
Doesn't hurt at all?
just feels like it's stretching out my spine.
I see. So we actually saw now your neck just moved a bit as she put a little more. Did you put more weight on it, or?
Yeah, it was 11 pounds, so it was just not enough. Like
How much did you put it?
To 20, and
So
now it's releasing.
So it's releasing. You
For
can
10
actually.
seconds,
I
then we
see.
just change it.
You can actually see it.
It'll come on
There it
right
goes.
now.
It's moving. That feels okay?
Yeah.
Okay.
So it's going to pull and hold for 30 seconds and release for 10 seconds. That's what I have set it for now.
Okay.
And we can change depending on the patient. If they are really acute, I would go for less time in traction and a little bit more time in rest.
I see.
And change as they get in subacute phase or chronic phase on how much they can tolerate.
It's actually relaxing. It feels like it's just pulling my neck and my spine and straightening my back out. Feels good, definitely. I can actually almost fall asleep as they do this.
So the bottom line is, I love traction. And if I had a cervical herniated disc and I wasn't having severe pain, numbness, tingling, and weakness, but more milder symptoms, and I didn't have a tremendous herniated disc on MRI, I would do traction. I would do it either with a home cervical traction, I would do it with a physical therapist, or I would do it with my chiropractor. I think I understand the principles of the traction, and I always like things that make sense. So if you don't have a tremendous herniated disc where it's a danger to the spinal cord, traction is a good bet and certainly worth trying. I'd put this high on my list, and I endorse it.